Anterior approach hip replacement is a truly minimally invasive way of doing a hip replacement. Rather than going through the side or through the back, you actually go through the front. And by going through the front, I do not cut any muscles or tendons, but rather split muscles, doing a true muscle sparing approach, allowing me to get access to the hip and proceed with a hip replacement. The massive advantage with an anterior approach hip replacement, it's muscle sparing, it's less destructive, it's less painful for the patient, allowing you to get up on your feet earlier, get off crutches earlier, return to a higher level of function. The literature is quite clear that especially in the early and medium period, there are significant advantages to an anterior approach hip replacement if done well. So whether one chooses to have a hip replacement via the anterior approach or the posterior approach, loosely speaking, the risks of complications are at the same rate, although there may be slightly different complications. For example, with the anterior approach, as the surgical incision is done through the front, it may not be favoured in patients who are obese in that area because there may be a slightly higher risk of wound complications at the front. Otherwise, the risk of complications between an anterior approach and posterior approach are largely the same, including but not limited to infection, dislocation, nerve injury, fracture. The likelihood of occurrence of a complication following a hip replacement surgery in the early period is low, and that would be rated at 1 to 3%. And the lifetime risk of a complication following a hip replacement could be in the order of 10%, less than 10%.